I'd like to thank the organisers of this symposium for allowing us really the platform to discuss about the insights of suicide, and particularly suicide of middle-aged men. I think a week after International Women's Day, it's probably right and fitting we have Middle-Aged Men's Day here in Ireland. And from somebody who fits in the age profile within that, and some of the other profiles that's in the book, I think it's fitting we discuss that. In the past, suicide and the statistics shown within suicide was of a younger profile, and the suicide rates were particularly between the age of 18 and 24. But that has increased, and this is after the recession, and as we come out of the recession now, our rates are actually have increased in age profile from the middle-aged cohort of men. Just in the context of today, the National Office of Suicide Prevention sits within the HSE, although the responsibility of implementing Connecting for Life, which is our national strategy, lies with my office. We have to liaise with various other departments, with, for example, health, justice, agriculture, education. So the drive is coming from my office, but it's the responsibility of a lot of offices for the implementation and departments of the recommendations of Connecting for Life. The primary focus really is on the implementation of Connecting for Life, and it's a multifaceted approach. And I want to just remind everybody, suicide prevention is not just the HSE's responsibility, it's the responsibility of everybody in this room, all departments, and everybody in Ireland in general that has an interest in this, or we need to get people involved in talking about it. It identifies middle-aged men within our strategy as a priority group, and there is evidence of vulnerability to and increased risk of suicide, and Goal 2 within our plan sets out measures that we have taken and we are undertaking to support most at risk within that cohort. It's against this backdrop that our office is delighted to fund this extremely important piece of research and to take the voices of middle-aged men to the national agenda, and indeed through communication within the public in general. Suicide has been described as one of the greatest tragedies that affects individuals, their families and communities. And I think that is so important. And we talk about road deaths and we talk about all different tragedies, but the suicide and the after effects of suicides and the effect it has on communities is really devastating. Nevertheless, I think it's so important to note that despite what we hear from time to time in the media, and this is usually negative press, Ireland's overall suicide rate is not as high in European standards as the press would lead you to believe. In the Eurostat statistics and the comparisons within that, Ireland rates 11th lowest rate of suicide among the 32 countries which are involved in that particular data collection. While there's an increase in suicide rate in Ireland between 2007 and 2012, data from 2012 onwards indicates that there's a levelling off of the suicide rate here in Ireland. In 2015, there were 425 confirmed suicide deaths in Ireland, and this figure, together with some provisional 2016, suggests a decreasing trend in the suicide rate in Ireland. Suicide can only be determined by the coroner, and that's why we go on retrospective data within that. So it's when the coroner determines a death within suicide, that's the statistics that we use within that. We welcome this, of course, but we also know that there's many different strands to suicide prevention. And one of our greatest challenges indeed to ensure the work is strategic, evidence-based, evidence-informed, and coordinated across the whole landscape of Ireland. Looking at some key national trends, men are 4 times more likely to die by suicide than women. The highest rate of suicide are currently, as I say, among 45 and 54-year-olds, and this has been consistent since 2010. And really, what's it really like for these men? How do they cope? And how can we best engage and connect with them? And what does support really mean? Support can be different in all of us, and what may support me and support Jason McAteer may not support other people. And we need to look at the voice of the middle-aged men and bringing that forward within that. It also shines a spotlight on middle-aged men who are gay, transgender, travellers, victim of domestic abuse, members of ethnic minority groups, farmers, unemployed, rurally isolated, ex-prisoners, or separated and divorced fathers. It explores the policy and research context and identifies a wide range of midlife transitions that are associated with the recurring set of challenges for middle-aged men. And indeed, in Jason's feedback to you and his personal story, you can see a lot of those that has been identified triggers within this piece of research today, which we're launching, is relevant to Jason as well. Just bear with me. The National Office for Suicide Prevention, we believe that with the right help, support and or intervention at various different stages, that suicide is preventable. And I want that message to go out today, that with the right support, at different stages along the journey, that suicide is preventable. And that no single action can prevent suicide. It's a combination of a lot of actions within that. The rates that and the information within this report and within our annual report within the National Office of Suicide Prevention are population based, and a little bit you took a higher age profile within that, but when we understand the population based profile, it requires us within the HSE then to focus on services that are right and proper and are actually targeted based on research. Part of our annual report last year, we also worked in consultation with the National Suicide Research Foundation based in Cork, and they looked at the emergency department and presentations within the emergency department of self-harm, and it's very reflective of the piece of work done by our office and indeed the WHO in relation to the profile of suicide. And the actual age profiles were a lot younger, but an example that helps us within the HSE is that a lot of presentations to the emergency department happen this weekend, St. Patrick's weekend, usually out of hours, usually the influence of alcohol and other substance misuse. And my background is a clinician within psychiatric nursing, but I remember it was anecdotally saying, no, people do not present out of hours. We have the research now to show that they do, and it's usually under the influence of alcohol. So we need to target our resources within that and front load it to a health promotional, Healthy Ireland point of view within that. The report launched here this morning represents another unique and strand of invaluable knowledge and insight, and something that would lead us on our journey into the future in relation to service provision. The National Office for Suicide Prevention welcomes the findings within this report and indeed the recommendations, and we look forward to a very concentrated, coordinated approach to that. When you look at the recommendations, advocacy, connection, communication, education and training, stigma reduction, support, that is all included within our Connecting for Life and has been identified through an evidence-based research. It's also part of the story that Jason told, and I've heard, I've been in forums like this where other key people have shared their story, and you can actually recognise the facets of their story and the research that the outcomes of research that's showing us. I suppose to conclude today, I'd like to highlight that the completion of this phase of the project was only achieved through the generosity, goodwill, support, advice and practical assistance offered by a broad range of individuals and indeed organisations. I'd therefore like to acknowledge and thank just a few, if you bear with me, that's important. Firstly, the report authors, Shane O'Donnell and Dr. Noel Richardson from the National Centre for Men's Health, the Institute of Technology in Carlow. I look forward to hearing Shane and Noel give us an insight into your key findings, and can I thank you very much for your input within that. I'd like to thank Colin Fowler and all at the Men's Health Forum in Ireland for commissioning this work and for your tireless work in this area. We do thank you for that. All the individuals who contributed through the advisory group for this phase of the project, for their generosity, time and input throughout. To Jason McAteer, and although Jason said he didn't know he had to speak, I did tell him he had to tell his own story. And in fairness, he didn't use any of the briefing notes that we gave him. And he did talk about his story. And that is actually much more important than any briefing notes that we can give anybody once you hear the story, and the focus is on recovery within that. And if you noticed, part of the stigma reduction, the communication, the advocacy, you know, the interlinks with his story and what have come out through your piece of research is really, you know, what else can you say? It's important. We based our where we're having the island of Ireland with a reduction and fewer suicides is based on a 10% reduction to the end of our strategy, which is 2020, and this is based on the WHO recommendations as well. And I'd like to be associated with Kate's welcome to our international colleagues and from the WHO, and indeed everybody here today. Lastly, can I take this opportunity to thank Finian Murray, Dr. Kate Hartigan, Fergal Fox, who has a constant, I think both of us must be on our number one text and email over the past few weeks, and all at HSE, Health Promotion and Improvement. To all my staff within the Office of Suicide Prevention. And can I thank you all here today, and if I can leave you with one important message, is please, if you look at even the synopsis and the executive summary of the report, and share the recommendations within that, because I'm like a broken record. Suicide prevention is all our responsibility. It's not just the HSEs. And I hope you have a very informative day. And thank you very much for inviting us here today. Cheers.